Welcome back to Behind the Headlines. More than 400,000 Missourians buy their medical insurance through healthcare.com. That is the Affordable Care Act marketplace. If you're one of them, brace for sticker shock next year. Suzanne King, who is a health reporter for the Beacon Independent News Service in Kansas City, has been looking into these higher costs, and she joins us now. Welcome back, Suzanne. Always good to have you with us.
Thanks. Good to be here.
Okay, so are all the insurers offering ACA coverage, raising rates? And if they are, by how much?
Pretty much. Based on the proposed rates they filed with state regulators, KFF did a survey earlier this month, and they are all but I think 4 across the country are raising rates next year, and pretty significantly. The median increase, as you know, rates vary based on where you live and how old you are and a lot of different factors, but the median increase is about 18%.
Whoa.
And that's 11 points, 11 points higher than last year, and it's the biggest increase since 2018. So it's pretty significant.
So who and what is driving up prices or these rates, and why is that happening?
Well, the insurance carriers, give reasons that we've heard for a long time, like the price of, healthcare is going up, labor costs are going up, inflation, those kinds of things. The big reason this year, the thing that's really different this year, is that there are policies coming out of Washington and the Trump administration that are changing kind of the rules behind the ACA marketplace that are going to be driving rates up. And also the big one is there are tax credits that lower what people have to pay to have insurance on the marketplace. And those expire at the end of the year if Congress doesn't renew them, and it doesn't look like they will. So that is likely to lead to a lot of people dropping out of the marketplace. So insurance companies are kind of anticipating fewer healthy people in the marketplace, which will increase their costs, which drives up rates.
So this, the higher rates, as you just said, will make it harder, which is more people are going to just let it go then, sounds like.
Yeah, that's what is expected. Between about 8 million people possibly will become uninsured over the next several years because of these changes. So it's a big number.
Yeah, have you been able to zero in on what the likely number is here in Missouri of folks that will just give it up, lose it?
Yeah, so it's hard, it's hard to say, but I can tell you that since those enhanced tax credits went into effect in 2021, Missouri has a total of 417,000 people on the marketplace. So that is double what it was in 2021. So twice as many people have insurance through the marketplace, and that's the same across the country. The number of insured people have gone way up largely because of these enhanced tax credits. So one estimate I saw is that in Missouri, just from losing the tax credits, about 51,000 people are expected to drop out of coverage.
So you really don't have to be a doctor, do you, to know that people will probably just put off their health care and will probably get sicker because of this?
Yeah, that's the concern, that especially if you're young and you're healthy, you're not going to want to pay a ton more, or you can't afford to pay a ton more for insurance.
Sure. Yeah.
So you drop out, and then that leaves and then some people who do need coverage are left out of, can't afford to go to the doctor until it's really, they're really sick or they need to go to the emergency room, and then their care is going to cost a lot more. So it's a cycle that just, keeps the whole ecosystem is kind of damaged when it's more, more sick people, higher costs. That affects hospitals and doctors and the whole, like I said, the whole ecosystem.
Yeah, and probably more waiting time in the ER People will just show up
Right,
there,
right. Yeah, yeah,
Okay.
for sure.
Okay. So you mentioned earlier that these proposed rates have to be approved by insurance regulators before they can go on the marketplace. But will next year's changes mean less help for people that do, or the information that's available about what the policies will
Yeah,
cover?
so that is that's a factor. So it's something else that the Trump administration has changed, which is when you'll remember back when um, they first came into office, there were a lot of cuts, federal budget cuts, grants being cut. One of those things was funding for what are called healthcare navigators, and so a lot of organizations like community health clinics have people who will assist you if you need help finding insurance, finding a plan, but also provide information about when to go get your marketplace insurance and when the enrollment window is and things like that. That money is pretty much gone away. So part of what's going on too, and part of what's expected to drive people to drop out is a lack of information that's going to be available.
Oh my, okay. Well, we will leave it there for now. Suzanne King with the Beacon News Service in Kansas City. You can see Suzanne's reports and other Beacon reporters' articles online and on social media, as well as this conversation at KY3.com and on the KY3 News app, Roku, Fire TV, and Apple TV+. Suzanne, always good to have you drop in. Thank you very much, and we look forward to next time.
Me too. Thank you, Steve.
Okay, see you soon.